So welcome back from the break. We're just gonna, in the last sort of 10 minutes here, talk through building networks. We'll have a third exercise, and then we'll have a quick discussion around planning for impact with some examples from the Nature on Prescription Handbook. So in terms of building networks, in workshop 1, if you came along to that, you may remember Noreen Orr talking about pets as therapy, which was a mixed method systematic review on how animals impact the health and well-being of care home residents. The audience for that project was care home staff. And from research, we know that many care home staff report positive attitudes to research, but that their use of research in daily practice is generally low. That's for several reasons. So access to information is often less than ideal, and access to those sort of main sources of information, such as computer and internet while at work, and staff motivation to read research literature in what is a task-orientated work culture have been identified as potential barriers for care home staff uptaking research into their practice. So in order to address these things, the research team looked at creating short, easy to read, visually appealing newspaper-style briefings suitable for reading on staff breaks, for example. So these were created in electronic and paper copy formats. And in the workbook that accompanies this series, we'll provide links and examples of those products. But you can see an example here on the left-hand side of the screen, the Daily Muse. That was produced by the research team as a briefing in a fairly short format that was designed to be more engaging with, images, clear text, non-specialist language, particularly for care home staff to understand some of the research outputs and the findings from the Pets as Therapy systematic review. The distribution was mainly electronic because that particular project came just before the pandemic, and that created its own challenges to distributing hard copies to care homes. However, one of the reflections from that project was that written formats are not suitable for everyone and can easily be lost in that volume of sort of written and electronic information that organisations get on a daily basis. So in terms of considering your audience, it's useful to reflect on quite what sort of format people like to digest information in. Second example that I've shown up here in the middle there is the project that I worked on called Peer Support in Neonatal Care. This was a systematic review looking at parent-to-parent support for babies cared for in neonatal units. The audience was neonatal nursing staff. So again, we wanted to reach, rather than just sort of standard journal outputs, we wanted to reach practitioners, neonatal nursing staff and clinicians, to show them really what we had found as part of this systematic review, and hopefully to get those research findings into practice in a slightly more direct way than one might anticipate just through publishing via journal articles. So we spoke to clinicians and we spoke to nurses at different neonatal units to find out what they read in staff rooms. And we found that in this instance, the infant magazine is distributed across all neonatal unit staff rooms at that time. So we wrote an article with 2 of our non-academic research team, a neonatal nurse and a consultant paediatrician, and published it in Infant Journal using infographics, which we'd created with our parent advisory group. This was a far more engaging and summary publication than some of our more academic facing publications. And we heard anecdotally that uptake was really popular and people mentioned this research quite regularly within the neonatal staffing setup. The final example I'm presenting here is a Nature on Prescription Handbook, and that's on the right of the screen here. So this was a piece of work based on a realist review and interviews, quite a large sort of series of projects and evidence base, and it was looking to address how nature on prescription can be used to support people's mental health, and particularly to make evidence-based suggestions for how to develop and implement a high-quality nature on prescription scheme within green social prescribing. The audience we were looking to target was nature-based providers of group nature-based interventions, targeting common mental health conditions, particularly mild to moderate anxiety and depression, delivered via social prescribing schemes. So those people also included, that we were trying to reach, also included link workers, general practitioners, mental health practitioners, and researchers with an interest in this area. The aim was to create a handbook that was portable, shareable, and we created paper copies and electronic versions. This handbook was developed through a series of iterative workshops with over 50 stakeholders, including wildlife trusts, Natural England, local nature partnerships, health and environment public engagement group at the European Centre for Environment and Human Health, so part of our patient and public engagement activities at the University of Exeter. Also, we worked with the University of Exeter Lived Experience group at Mood Disorders Clinic at the University of Exeter. We worked with the Wild Planet Trust, Surf Action Cornwall, the WAVE Project, Bumblebee Conservation Society, a huge number of stakeholders who really helped us in shaping this handbook for a practical purpose. So the real aim that we wanted to make sure was that this was understandable, people could engage with it. There's an awful lot of illustration, a lot of space, a lot of colour used throughout. And it feels like a far more engageable handbook rather than a classic academic output. Again, I will share links within our workbook that accompanies this series to the Nature on Prescription handbook that you'll be able to access and download for free if you are interested. If you have any troubles with that, or you can't for any reason download, send me a message, h.a.hunt@exeter.ac.uk, and I will send you a copy of that handbook. Okay. So just moving on to the third exercise, I'll pause the recording, but we'd ask that in the chat, you take 5 minutes to discuss building networks. So who are your current networks? How could you work together to communicate research more creatively? And what are some of those questions that you've got about you'd like to do X or Y, but you're not sure about A or B? Some of the challenges, some of the potential barriers, things to bear in mind. So I'll give you 5 minutes and I shall pause the recording at this point. So moving on to the last section of this workshop, I'm going to talk around planning for impact and giving some examples from my own work, and then wrapping up with a reference to the next workshop and a link to feedback. So in terms of planning for impact, there's several reasons to plan for impact, and particularly around the research excellence framework, which in academic circles is a really key metric for looking at how research is used in practice. So for the purposes of the REF, impact is defined as an effect on change or benefit to the economy, society, culture, public policy or services, health, the environment or quality of life beyond academia. So it's that key aspect of beyond academia, getting things out into the real world, that makes a real difference in terms of REF metrics. So for REF 2029, which is the next iteration, impact will be assessed in terms of rigour, reach and significance. So I, again, will share the links to REF 2029 and the University of Exeter case studies from the previous REF 2021, in the workbook that accompanies this series. Some of the things that can help in terms of planning for impact are activities that we've, talked about throughout this workshop and the previous workshop, around knowing your stakeholders, planning up front, making sure that you are realistic and bounded in what you're planning to do so that it can be achieved. Part of that is using the tools available. So planning creative engagement and communicating your research from the beginning. So making sure that that's planned up front is really, really important. Some of the tools you can use to help with that are stakeholder mapping, making sure that you have a really clear idea about who it is you want to be talking to. So you're not taking a sort of broad brush members of the public or non-academics approach, but you're being really specific about what effect you want your research to have and who it is that you're directing those research findings to. It is always a two-way street, so it's definitely worth reflecting on how early you can bring people into your research, forming advisory groups, making sure you've got somebody on the research team, at least somebody who is part of that wider voice and that wider community, are really, really key things that can make a huge, huge difference and huge impact from your research. So stakeholder mapping, vision mapping, creating a theory of change, for example. So developing a sort of really comprehensive description and illustration of how and why a desired change is expected to happen in a specific context, or creating a logic model, which normally takes the form of a graphic depiction. You can have a table of some form of if-then statements. So if X happens, then Y will be the result. If-then relationships between various elements that lead to an outcome that you're looking for. So those are sort of slightly more formalized tools that you may be able to use in terms of planning for impact. Looking at your own institute's ref case studies are really helpful to see how you might start planning that early on in your piece of work. You won't be able to do this for every piece of research for various reasons, but if you have a piece of work that you think might make a suitable ref case study, or even if you're just not sure, planning early doors is really valuable in this space. So moving on to an example, and this isn't specifically a ref case study, but it is a piece of work that I have collected impact metrics on. So this is the Nature on Prescription Handbook that I referenced earlier. We set this up so that it was free to download, but at the point of download, we would collect data from the people who were downloading it. So very simple metrics of name, country of origin, which is captured with the IP download details, and contact address, and whether people want to be involved in future, whether they opt in or opt out to further information around the handbook. So really simple capturing of data, but it's helped us to understand that since we've launched this in 2001, we've had over 4,000 downloads worldwide, and that's just from one particular source. So we've also made it available on the European Centre of Environment and Human Health web pages, and people can download from there. That also captures download figures, but at the moment I don't have them, so they will sort of be added into this at some point. But we know that it's going to be far more than 4,000 downloads worldwide across every continent. You can see there some of the numbers, 48 downloads in the Netherlands, and 103 in Australia, 94 in Canada, 112 in America. These look like relatively small numbers, but they all add up. And we've also had reach in countries one might not anticipate. So Republic of Korea, we've got into Nigeria, Pakistan, Romania, Russia, Saudi Arabia, a lot of different countries and a lot of non-English speaking countries where this is at the moment a publication in the English language. So quite a lot of reach. these are a couple of quotes from people who have used the handbook and found it particularly useful. So we capture them when people contact us. We did a feedback exercise when we first launched the handbook, and I had an awful lot of comments from that. So that's just another example of really quite simple metrics that you can capture to show reach, a degree of impact. As Jo mentioned in the earlier half of this workshop, capturing impact is a challenge, and you're very rarely, unless you have a very specific sort of data capture tool, you're very rarely going to be able to have an all-round understanding about all those different metrics. But there are ways of getting a sense of how broadly your work has been shared and seen. So if you have any questions about that, do drop me a line. I'm going to wrap up here, and the final slide is a preview of workshop 3. So that's taking place on Wednesday, the 22nd of May, and it's being presented by Dan Porter, who is one of the co-founders of Scriberia, which is a visual thinking agency I've worked with on several projects, and he's worked with Oxford Sparks and Ministry of Justice, Ministry of Defence, lots of government agencies, lots of academic institutes. And I think that will be a really, really interesting workshop that's shaping up very nicely. So the workbook and slides will be available for this workshop and for the whole series. They'll be freely available on the University of Exeter web pages, and I will email attendees with those details when they're ready at the end of May. If you have 2 minutes to give me a bit of feedback on this presentation, that would be super. And for those of you who have signed up, I'd look forward to seeing you in the next workshop. And if you're not signed up, there's still plenty of time. So get in touch or follow the links on the promotional information out there. Okay, thank you.